Hi, this is Tim Rice, CEO of Cone Health. We're here today to celebrate the 60th anniversary of the opening of Moses Cone Hospital. So as we celebrate, I'm going to wander around and ask some of our long-term employees what they've seen specifically in the past 2 years change at Cone Health. So follow me. So Danielle, how long have you been at Cone?
It'll be 20 years next year.
She started when she was 5.
Well, I was actually a candy striper when they still wore candy striper uniforms.
So what differences have you seen now over your years here?
Oh my goodness. And besides the technology and, gosh, lots and lots of roles, being integrated in patient care, not just nurses anymore.
What have you seen different the last few years?
Well, we're closer as a family. We've always been closer as a family, but we're just moving forward, not backwards. And that's what it's all about.
37 years.
37 years.
God, you got me beat.
I know, and I'm loving it.
Great, thanks. So Lisa, how long have you been part of Cone?
I've been with Cone since '09.
So what difference have you seen in Cone here in the last 3-4 years now?
The last 3-4 years, I've seen a lot of improvement. Coming from the hospital that I used to work at, Cone is a plus.
We won't mention that hospital.
No, we're not going to mention the hospital. No, we're not.
Now, you were on the trustees for a long time, so it's going to be hard for you to say in a few words what have you seen change?
I think the biggest change I've seen is the merger and the unification of health cares between the various groups. Now the merger of Wesley Long and Cone and the Humana absorption, so that there's one provider for all of Greensboro.
So what do you think is different about Cone these days from when we first knew each other?
I think what's different about Cone is the environment. We are more welcoming and with our values of caring for our patients and each other and our community. I think everyone has really bought into that.
Dr. Dean, you've been here a long time.
Yes, I have.
Well, just share with me, what do you think about Cone Health today and what you've seen recently in just the last few years here?
Yeah. Well, I think one of the biggest things I've seen is just more the attitude has changed quite a bit as far as my patients when they come to the hospital, just their perception of how concerned the medical staff, the ancillary staff has been there. I mean, it's been a real big change with that over the years.
How long have you been at Cone, Steve?
8.5 years.
So what changes have you seen, particularly in the last 2 or 3 years here at Cone Health?
A lot of people's attitude and the way they look at their job and the people, co-workers and all. I've seen a change for the better.
It's Tim Rice.
How are you?
I'm doing good.
How long you worked here?
28 years.
28 years. I got you beat. By a little bit.
I know. Well, you're older.
So what changes have you seen at Cone, particularly in the last few years?
It's a friendlier place to work, and I think it's become more for the employee in the last few years. It was becoming much more management leaning, but I think there's a lot more for the employee now, and it's a kinder, gentler system.
So we couldn't be here today without all of you. Thanks for everything you've done at Moses Cone Hospital the last 60 years. I look forward to a real exciting future together. Thank you.